So if you did have clitoral pain, or you still are having clitoral pain, burning, or it just doesn't feel right, one of the best things to do is to start touching the clitoris. You heard me right. You gotta start touching it to get it desensitized. During delivery or after delivery, did you experience clitoral pain or pain in your clitoris? A lot of times this is a very common experience that can happen during the delivery process. It can feel like maybe your clitoris is tearing, it can feel like it's burning, and then this pain can continue throughout your postpartum experience. It can last for a couple weeks to a couple months to a couple years until you actually get treatment. And what is one cause of clitoral pain, and a very common cause of clitoral pain, is called compression of the pudendal nerve. And when we get compression of the pudendal nerve, which is the nerve that goes to the clitoris, the nerve that goes to the clitoris is called the long dorsal nerve, and it's just a branch off the pudendal nerve. But what happens as baby is coming down through the birth canal, the baby can sometimes pinch the nerve or cause compression to the nerve, which then can lead to weird feelings in the clitoris, feeling like it's being torn off, feeling like it's burning or tingling. I had this experience with my second, and it was by far so uncomfortable. I thought my clitoris was getting torn and ripped off, and that lingered for about 3 weeks until I started to desensitize the clitoris and start to heal the pudendal nerve and heal the area in which we're affected. So I want to talk to you about that so you can learn how to heal this yourself. And if you're not able to heal it yourself, we can help you with that at our Edmonds or Poulsbo locations in Washington State. We do this for people all the time after they have babies. They will come for an intensive week of therapy, fly out, stay here in the area, and then come to the clinic for longer healing periods so we can get this taken care of. And what this looks like when you have this clitoral pain, I'm gonna give you a few tips too, so you don't have to worry. Like, you're gonna get some tips in this video to truly help to start to heal that clitoral pain. But what this looks like is we have to work on desensitizing the nerve and the tissue. So if you did have clitoral pain, or you still are having clitoral pain, burning, or it just doesn't feel right, one of the best things to do is to start touching the clitoris. You heard me right. You gotta start touching it to get it desensitized. So right now it just knows pain, and it's probably a little bit stuck and frozen. And the clitoris, which is the yellow dot here in my pelvis, it's right where these two muscles meet. And essentially it's right underneath the labia. So if you take the labia majora away, you'll see the glands of the clitoris. And if you can start touching it and just gently touching it, if that's too uncomfortable, you can take a tissue paper or you can take a Q-tip and just start gently touching. But if you feel okay with it, you can also start to use your finger and just touch around it. And then once that starts to feel okay, you can start to move the tissue on the side of it. You can move the tissue on the other side of it. And of course, you can always do masturbation to help desensitize this area. You might not have any sensation when you are doing it, but the more you stimulate it, the more it's going to be like, oh yeah, okay, this is okay, this isn't painful. And then hopefully it will lead to you regaining pleasure in that area again. But at first, we just want to get rid of the burning and painful sensations. Once you have desensitized the clitoris with that type of touching, then you can use your finger to start moving the labia around. And when you pull the labia up by the clitoris, you're also moving the clitoris and giving it a nice little stretch. And you don't want to pull for longer than 5 to 10 seconds. You're just pulling, holding the tissue for 5 to 10 seconds, letting it go. Now, if you pull and you feel the burning, that's okay. Just make sure that when you let go, that burning completely goes away. And then, if it doesn't, that means you've pulled too hard or for too long. And so you want to shorten the amount that you're pulling, the duration, and you want to shorten the intensity of which you're pulling. You might just have to start with teeny little movements of the labia, or just start moving the labia again. And then you can move the labia all the way down towards the opening of the vagina to start to just get stimulation in that area. During childbirth, these tissues expand extensively. And a lot of people think, okay, well, everything is just expanded and it doesn't, do anything. The reality is all the tissue recoils as we heal postpartum. The body is an amazing natural healer. But the deal is it recoils typically really tight, and because a lot of the muscle fibers were overstretched past normal stretch points, it creates little micro tears in the tissue that then create scar tissue. So even if you weren't stitched up, you still might have micro tears in your tissue that the tissue's now not opening and closing as well, and that becomes a problem in healing the core postpartum. So we want to get that tissue moving really well again. And so you can do this with desensitizing the clitoris, you can do this with moving the labia, and then you want to also make sure you're breathing. So a nice belly breath is an amazing tool to start opening up the pelvic floor. Let me show you how this works. When you breathe in and inhale, your diaphragm goes down underneath your rib cage and pushes down into the belly. The pelvic floor, the 3 layers of muscles down here, then also are going to open and start to create that opening as you inhale. So you inhale using your diaphragm, inhale and open, and as you do that, the pelvic floor is then opening. And you're like, again, why do I want to open these muscles? They were just totally blown open. The reason you need to open those muscles is because now they're frozen shut, and that can also limit the ability of the blood flow to get to the tissue, so it can become very dehydrated, almost to the texture of like a beef jerky, where we want these muscles to be hydrated like a chicken breast or like a nice healthy juicy steak. We need that hydration of the muscles in order to have really healthy tissue, and so the breathing is going to help start to stimulate that tissue. Now, working with us as a pelvic expert physical therapist and really working to heal these muscles and help decompress the pudendal nerve, restoring that normal movement to the clitoris is all going to help not just heal the symptoms of the clitoral pain, but it's also going to help revitalize and restore your core after having babies. And you can check out my book for more information on that. It's called Restore Your Body After Kids, The Secret to Avoid Peeing Your Pants and Achy Joints as You Age. And that book gives a really good description, and it starts with an exercise program of truly how to start to heal your core after you've had babies. And it will help you heal the clitoral pain as well. But start with these 2 exercises. Start with the desensitizing the clitoris, moving the labia around, and then go into the breathing and really start to use your breath to open up your pelvic floor and bring the blood flow to that area and help to improve the tissue. It is going to improve your intimacy. It's going to improve the function of the clitoris, so your orgasms will be better. And I hope you found this information valuable. I'm Dr. Allison Felt, owner of Body Motion Physical Therapy, and we want to help you heal your bodies fully and completely after kids so you can live a fulfilled life with all the vitality and energy in the world, either for more babies in this world or for the rest of your life. Take care.